Hello everyone, and welcome to this audio podcast. This audio podcast as part of this the series of the edition, the Papillae Sirocco. And this audio podcast is part of our Labostix Communicado. This audio podcast is part of a Squadron Kamikaze, and this audio podcast as part of a Storm Labostix production. In this audio podcast, part of this audio podcast, a little into the intro, looking at HUS, clinical medicine versus clinical anatomy. So, hemolytic uremic syndrome, or HUS, occurs due to a Shiga-like toxic activity through aberrant complement activation. HUS is typically classified into two primary types. Number one, HUS due to infections often associated with diarrhea. For example, where you have D positive HUS, Shiga toxin producing Escherichia coli HUS, with the sort of rare exception of HUS due to severe disseminated infection caused by Streptococcus. And number two, HUS related to complements such as such as HUS is also known as atypical HUS and is not diarrhea associated. So not diarrhea associated, whereas referred to as DHUS or AHUS. AHUS mean atypical HUS, and HUS being diarrhea associated hemolytic uremic syndrome. So clinical features include proteinuria, renal involvement, and history of E. coli diarrhea, which are generally a hallmark of typical HUS. Encephalopathy is rare, but can cause death in HUS recipients. And HUS is seen increasingly following outbreaks of infections with virotoxin or VT producing organisms. It represents a sort of a growing public concern, and a health problem, and data suggests that more awareness of specific microorganisms causing diarrhea and those thus leading to hemolytic uremic syndrome and or HUS related symptomologies or symptoms may become more important in prospective health, in perspective of future sort of consultations with children or young people and parents, where there is suspect or high risk for HUS. E. coli 01015787 is perhaps the most commonly notified VT producing organism in the United Kingdom and in France, in Europe. Clinical manifestations may vary from asymptomatic infection to a bloody sort of diarrhea and hemorrhagic colitis, and HUS. Virotoxin and enterococcal or VTEC associated HUS was seen in up to, or has been seen in up to 20% of patients in outbreaks in around recent outbreaks, and mainly affecting children or pediatrics or young people. In the peer reviewed works, there is a in the peer reviewed works there is an overview that defines the classification of hemolytic uremic syndrome and sort of the sort of main main features of HUS, and so thus and thus and thus in around the classification around hemolytic uremic syndrome, HUS. The typical sort of classifications include where there is infection relating. There's a Shiga toxin producing E. coli and Shigella, pneumococcal infection, HIV associated. There can be an HIV association to HUS, and other viral or bacterial infections. And then atypical, you have complement factor abnormality, and then factor H deficiency and factor I deficiency. And then in around miscellaneous being some of the symptomologies that can be linked that can be linked to HUS, hemolytic uremic syndrome, though are not specific. So, for example, cumulative traumatic disorder, drugs, certain drugs or medications, and malignancy. And sort of the defining features of hemolytic uremic syndrome is where there is renal involvement. There's evidence of coagulopathy, so there's issues in the coagulation in around the clotting sort of clotting cascade in around coagulopathy, intravascular coagulation in the kidney. There's antipathy where there's marked fragmentation in under histological investigations where there's fragmentation of red cells can be seen. And then there's the disorder is associated. The disorder HES is associated with the activation of neutrophils. And then there's typical HUS, which is secondary to gastrointestinal infection with virotoxin producing E. coli, 0157H7 VTEC, and less often Shigella. And then there's complement activation, which is used to attack foreign bodies, and there's complement system is highly regulated to prevent it from damaging healthy tissues and organs. There's platelet activation, which is damage to endothelial cells, cells that line the blood vessels, and there's white blood cell activation causing hemolysis. There's also TMA, thrombotic microangiopathy, formation of blood. There's blood clotting in small vessels throughout the body over time, causing multiple organ damage, causing multiple organ damage. At the same time, the peer review works looks into the varying symptomologies, sort of more sort of more pronounced sort of symptomology. So, for example, patients can present with low hemoglobin or anemia. There's petechiae and purpura and fever, which are common. There's gastrointestinal bleeding, which is often found found again with a bloody sort of diarrhea. Gastrointestinal disease may be severe with hemorrhagic colitis, toxic megacolon, and rectal prolapse, and bowel necrosis. And then there's neurological symptoms or symptomologies. There's can be cardiac involvement, which may lead to congestive heart failure or CHF in CHF and arrhythmias, and microinfarcts in the pancreas, leading to pancreatitis, or sort of rarely sort of with for example other conditions, other health comorbidities that are part of the symptom that are not often part of the symptomology, can often be picked up as part of the symptoms symptomologies, depending upon how the pediatric or young person is presented in front of a pediatric specialists. And so that draws this audio podcast to a close. The audio podcast in following will delve into some of the HUS Haemolytic Uraemic Syndrome sort of epidemiology, and so this draws this audio podcast to a close. There's been an audio podcast as part of the Papillae Sirocco, an audio podcast as part of a Labostix Communicado, an audio podcast as part of a squadron kamikaze, and an audio podcast as part of a Storm Labostix production.